Hi, my name is Amanda Pratt with Imagine Life Therapy, and today on the video blog I want to talk about a very sensitive topic, which is depression. We know that people with chronic illness experience depression at a higher rate than most people. Having a chronic illness can be stressful. It can bring about depression and anxiety. We know that depression is also a cycle. So we might experience ups and downs in depression, just like in a chronic illness. There's ups and downs, periods of activity and periods of remission, and it's kind of similar with depression. A lot of times people with chronic illnesses have situational depression because it just feels hopeless, especially if you are told that there's not a cure for your disease, and the treatments can be taxing and emotionally frustrating, especially when they come with side effects and they change how you look and they change how you feel. So I definitely understand feeling like you're depressed at times. And so some of the ways that you can recognize if you're depressed is that you might not enjoy things that you once enjoyed. So for example, you might get really excited about doing a certain activity, but if you're in a period where you're feeling depressed, you just might not even care about that activity at the moment. You're maybe feeling like you don't really even care about eating the way that you used to. You're not sleeping well. You maybe feel just that overall can't get up and go feeling, and that's a pretty good sign that you might be slipping into the start of a depression, or you might already kind of feel depressed. So it's important to recognize these, be aware that you're feeling this way, be aware that it's also normal in your situation, and I want everyone to know that it's okay to feel that way, and that sometimes we just need to address it. We need to look it in the face and say, you know what, I'm depressed right now and I'm not feeling myself, and so I just need to go get a little extra help so I can, get out of this depression and get back to where I need to be. So some of the things that are bad about being depressed, they may seem obvious, but to a person with a chronic illness, being depressed can actually cause you to not manage your disease as well as you would if you weren't depressed. So things like taking your medication regularly, eating well, sleeping well, resting, doing those extra things that you need to care for yourself and feeling okay about those things, that they're helping you. Maybe you miss doctor's appointments when you're depressed, and so you're not seeking out the care of your doctor like you normally would. These are all things that when we get into a depression, we do them because we're feeling not like ourselves, but then they can actually cause things to become worse, because if you're not taking care of yourself or managing your disease appropriately, you can then make your disease worse or more active, and that's not good either. And then that causes you to be even more depressed, and then it's just this big cycle where everything is getting worse and worse and worse. So an analogy for this is that, say you fall off of a ship and you're in the sea. You've got two choices. You can either sink or swim. And you've been swimming your entire life, right? You know how to swim, you're swimming, and you know that that's what you are going to do, right? And then someone comes along and throws you a life raft, right? Swimming feels comfortable. Swimming is what you know you're gonna do, but you don't realize that by swimming, you're actually going further out to sea, which is putting you even more in danger. And eventually, swimming just isn't gonna cut it anymore, right? So someone throws you a life raft, and now there's this strange thing there. You have another choice. Now you could keep swimming, which is what you feel confident doing, or you could take a chance and jump on that life raft. Now, to have someone pull you up, you're gonna have to hang on and use all of your body power to get onto that boat. And it's gonna be hard and it's gonna be exhausting, but in the end, it's gonna be worth it, right? And that's kind of an analogy I use to describe depression and getting help, right? We can either keep doing the things that we normally do because that's what's comfortable, or we can seek out help, like from a therapist, and let someone challenge us in a way that might feel uncomfortable, but in the end, it's gonna give us more tools to manage our disease better, to know what to do when we're feeling depressed, to recognize it, and to come up with solutions. And in the end, it's gonna be better for not only your depression, but for your disease management and your ability to kind of stay on top of that and stay with a positive mindset. So just to kind of wrap this up, if you're someone who is thinking about that or any of this has struck a chord with you, I want you to do a little exercise with me. And I want you to take a sheet of paper and split it into two halves and write pros on one side and cons on the other. And then I want you to fold the paper in half vertically, and on the top half I want you to write changing, and on the bottom I want you to write not changing. And I want you to create a list of pros and cons. Pros of changing, meaning going out and getting help and coming up with, you know, that life raft, that work that might be a little hard for you, but in the end is going to benefit you. And then not changing, doing things exactly the same way as you have always done, and the pros and cons of that. And that is how you can weigh whether or not you really need help and whether or not you're ready to seek out that help. And most people, including myself, know that when you look at that list, you realize that by not changing, it might be more comfortable, but changing is ultimately what's going to lead to a healthier, happier you. And it's going to lead to building a support system. It's going to lead to so many things that you just didn't even know were possible. And so I hope that you can find for you that this was helpful in taking the next step and seeking out a therapist, and hopefully you'll find someone who understands what you're going through. If you're in the Florida area, I'm St. Pete, so feel free to call me. I offer free 15-minute phone consultations. If you have a chronic illness and you're struggling with any of this, I really truly understand where you're coming from because I've lived it. And so I'm happy to help you, and hopefully I hear from you soon.